So good evening, all of everyone. Those here physically and those online. You are here physically is just by chance. This is an online class. Okay, so we are going to take levels of prevention. And the essence of this lecture is not because you don't know this topic, but we want to talk on the high yield topics for the MDCN exams. Okay, so we will be highlighting those topics and be talking on the important aspects. Okay, levels of prevention. You can see the slides. Okay, so levels of prevention are categorized into 4 major levels of prevention: primordial, primary, secondary, and tertiary level of prevention. Now, you should know that these levels of prevention are further broken down into 5 strategies or stages that you commonly know: the general health promotion, specific prophylaxis, early diagnosis and treatment, treatment of complication, and rehabilitation. But traditionally, levels of prevention are primordial, primary, secondary, and tertiary. Those are the traditional levels of prevention. And what do all these mean? When you say primordial level of prevention, is to prevent the occurrence of risk factor. Okay? You don't even want the risk factor to occur. That is primordial level of prevention. Okay? You prevent the occurrence of risk factor. That is primordial. Then what is primary? The level of prevention is going to specifics, being specific. Okay? Giving a specific prophylaxis against an ailment is primary. Okay? Now, if the risk factor are present and they already occur, you take some specific measures to prevent the development of that disease. That is primary prevention. Okay, so you should understand the difference. Primordial, you don't want the risk factor to occur. You completely eliminate them. You don't even want that to occur. Primary, you give specific prophylaxis. Why secondary is early detection of that condition and treating. That is secondary prevention. Why tertiary prevention has to do with treatment of complication and rehabilitation. So you can see these are the traditional levels of prevention that are categorized into the strategies you commonly mention. So you should be aware that in your exams, some examiners will reject these strategies. They will reject it. If they ask you, you see in an OSCE, the first question says, mention the level of prevention. And you start saying general health, education, and promotion. Some examiners will just reject that. So what you should start with is by mentioning the primordial, primary, secondary, and tertiary. That is what the general consensus of the examiners accept. Okay, because these 5 levels are actually strategies rather than the levels of prevention. So that is just by the way. You should know the levels of prevention and what they actually mean, what they entail. So now we'll talk about some common conditions that you should know how to discuss their prevention. Number 1, kwashiorkor. Kwashiorkor is a severe form of malnutrition, primarily affecting children, especially developing countries. You don't see malnutrition in developed world because of they are highly enlightened, okay, and they have adequate resources at their disposal. They are highly enlightened on the causes of malnutrition and what they have available resources that is well distributed among people, okay? It is characterized by deficiency of protein in the diets, leading to a range of physical and developmental symptoms. So this is just a short gist on kwashiorkor. So how do you prevent kwashiorkor? You are asked, number 1, primordial. What is the aim? Mitigate the societal determinants and risk factors that can lead to kwashiorkor. You even don't want those to occur by nutritional education, okay? Agricultural development to enhance food security, immunization, and poverty alleviation. Now, when one is highly enlightened on causes of malnutrition, how to prevent them, how to take balanced diet, of course, the risk factors from developing. So primordial targets educating, okay, the population on causes of malnutrition, the risk that will lead to kwashiorkor, and how to provide balanced diet. So education. 2, agricultural development to enhance food security and availability of wider range of essential nutrients. Immunization, then poverty alleviation. This provides adequate, okay, funds to even access proper diet. So that is the primordial, primary prevention. Now, we know you are being specific here. There are some specific measures you take to prevent kwashiorkor, like adequate breastfeeding, okay? You promote breastfeeding as exclusive breastfeeding in the first 6 months. You know, when you give breastfeeding with water, what do you call that? Yes, when you are adding water, it's supplementary breastfeeding. So what is the effect of that when you are giving supplementary feeding? No, infection is not the effect. What will happen? Yes? No, why is exclusive breastfeeding different from supplementary? If you give the child water, he takes water, he will not take sufficient of the breast milk before the tummy gets filled up with water and he's not getting enough breast milk. But if he takes only the breast milk to his satisfaction. He will get the adequate nutrients. Okay, but if you give supplementary with water, you are diluting. Okay, because the breast has water and other nutrients. So that's why exclusive breastfeeding, patient will be getting adequate nutrient for growth. So you promote exclusive breastfeeding, okay? Then dietary diversification. Not you keep on giving a child carbohydrate. That is very common in our society. Carbohydrate, carbohydrate, carbohydrate. You'll be giving a child that is growing carbohydrate, and you, the father, will be eating the meat. You see, some cultures will say that if you give children proteins, they will become thieves. So they avoid giving them eggs. Okay. You see, the larger portion of the egg or the meat will go to the father that don't even, he has finished growing, he doesn't need protein, while the child will not eat meat. That if he enjoys too much, he will become a thief when he grows up. You see, that is very serious trouble. So you have to give children adequate proteins, growing children, carbohydrate, fat should be all balanced. Now, hygiene and sanitation, because infections are causes of reduced feeding, especially in infants and children. Because when a child is sick, he doesn't feed well, and this will lead to malnutrition. And of course, he can develop kwashiorkor. So you have to ensure hygiene and adequate environmental sanitation, because if there is no good personal hygiene, they have high risk of transmitting infection, and they'll develop conditions like diarrheal disease, acute diarrheal disease that will lead to dehydration, dyselectrolytemia, and even nutrient from the GIT. And lack of good environmental sanitation predisposes an individual to what? A lot of environmental hazard for infestations and infections, malaria, worm infestation, and several other infestations. Okay, then healthcare access. You see, if individuals have no adequate access to healthcare, all these, they are minor issues, might not be addressed appropriately. Okay, don't forget, kwashiorkor primordial is to what? Eliminate risk factor by, you don't even want risk factor to occur. Okay? By educating the individual, telling the individual the cause of kwashiorkor and how to prevent that, providing food by agricultural development to ensure food security. Okay, poverty alleviation programs. Primary prevention goes to specific measures like exclusive breastfeeding, dietary diversification, good personal hygiene, okay, and access to healthcare. Now, secondary prevention focuses on early detection and intervention in individuals with signs of malnutrition, like supplementary feeding with nutrient-rich diet. When a child starts growing beyond 6 months, the nutrients within the breast milk will not be sufficient for normal and adequate growth. You have to supplement with other feeds like infant formula, not some cultural pride. Okay, the child have started eating, you just give him one piece of yam and continue breastfeeding. That is nonsense. You have to get formulas that are prepared mainly for these children, okay, in proportion that, okay, that are based on their body requirement for growth at their specific ages, okay? So you see some children breastfeed for long without having adequate supplementary diets. The iron content of the breast milk will not suffice beyond the age of 6 months, and they will develop anemia. Okay, the protein content and all other nutrients will not be sufficient. You can't just give the child, okay, the child have started eating, you just give him some handful of rice and beans. That is not enough. So you have to supplement their feeds, then regular health checkups and nutritional counseling of the mother. Okay, so most importantly, you have to detect some early signs of malnutrition. Yes? What are early signs of malnutrition? Alima.
Prominent body prominences, body wasting, muscle wasting.
Muscle wasting, yes. Weight loss, yes. What again? They can have diarrhea, yes. Why do they have diarrhea? Early signs of, there is atrophy of the villus of their intestine. Why? Because there are no adequate micronutrients and vitamins. Okay, they are required for all these epithelial. That's why sometimes you give them vitamin A, you give them zinc for good epithelial, healthy epithelial growth, and of course, absorption. Is it clear? So, yes, diarrhea, what else? Edema, yes. You've said weight loss, yes.
Frequent infection.
Yes, they are prone to infections. Yeah, so there are some early signs you'll be seeing and start preventing immediately. And you don't wait for a child to become bloated before you start treating. Okay. Delayed developmental milestone. You see, a child is 8 months, he can't stand. Okay. 6 months, he can't sit without support. 4 months, he's not having neck control. You see, there's trouble. This child, you are eating the whole protein and giving them slices of what they don't require. Yes? You don't want him to eat? Okay, tertiary prevention. What is tertiary prevention? Yes, it's what? Rehabilitation. Managing and rehabilitating severely malnourished individuals, preventing complications and relapses. Okay? Okay, therapeutic feeding centers. Now, some individuals might be so malnourished that they have to be rehabilitated. Okay, sometimes malnutrition, they don't even have appetite. You have to pass NG tube and feed them with what they require. And you have to be careful also in doing that so that you don't give them hyperosmolar things that they cannot absorb and they have osmotic diarrhea. Nutritional rehabilitation with gradual reintroduction of balanced diet. Now, there is no rapid feeding of a malnourished individual. Halima, what will happen if there is rapid feeding of a malnourished individual? Refeeding syndrome, excellent. Hope you know the components of refeeding syndromes. What are the electrolyte changes that developing? You go and check refeeding syndrome. Then follow up and support. So, in summary, we said kwashiorkor is a common, okay, condition in which you can be asked on how to prevent and use the primordial to prevent the occurrence of risk factor. Okay. 2, primary. 3, secondary, and tertiary. Now, the next condition we'll look at is tetanus. Tetanus is also common, and there are several things you need to know about tetanus with regards to your exams. All those vaccines that have tetanus components, anti-tetanus component in them in the immunization schedule during antenatal. Yes, what are those vaccines that have? Pentavalent vaccine, yes. What again?
Tetanus toxoid.
Do you give tetanus toxoid during immunization? During, what do you call it, antenatal? Which ones do you give?
Antenatal.
Yes.
Tetanus toxoid and
DPT. You give DPT. Okay. Sorry, there are some people that are not part of us. So let's just continue. Now, tetanus. So, in other words, in the immunization schedule, you have to look at all those vaccines that have tetanus as a component, like DPT. What is DPT?
tetanus.
Okay. Pentavalent, what are the components?
Diphtheria, pertussis, tetanus, hepatitis B, HIV.
Okay, then tetanus toxoid. And you should know the difference between toxoid and what? No, tetanus toxoid and yes, anti-tetanus serum. What is the difference?
Tetanus toxoid is from the.
Okay, let me just enable those that are online that wants to contribute. You can unmute yourself. Can they unmute themselves so that I won't be cheating them? Let me enable them to allow to unmute. Okay, yes.
So the serum is contains immunoglobulins, and then the toxoid is the toxin, the killed toxin from the.
You see, toxoid, okay, are derived from the organisms themselves. They are antigens that are produced from the organisms themselves. Either when you talk about antigens, either from a live or from live attenuated or what? Yes, you get antigens. Those particles are derived from the organisms themselves. And when they are introduced into an individual, the immune system of that individual produces antibodies against those antigens. Do you understand? Because these particles are derived from the organism itself. So they are now introduced into the individual, and the individual produces its own immunity against that infection. So that is called an active immunization. An active immunization. Why? Because the organism produces antibodies. While anti-tetanus serum are preformed antibodies that are introduced into an individual to neutralize the toxin. So these are antibodies preformed. So these don't last as active immunization. Passive immunization is short-lived because they are preformed antibodies to neutralize. When their half-life is over, that is all. While active immunity, the organism produces his own what do you call it? Antibody. So it's longer. Tetanus is a spastic illness. That is, it causes, what do you call it? Painful contractions. Okay? Painful contractions. Yes. Okay, tetanus is a spastic illness caused by tetanus toxin, tetanuspermine, produced by Clostridium tetani. It's a spore-forming anaerobic bacteria that is found commonly on the soil, predominantly on the soil. That's why most of the infection is when you have contamination, okay, with soil or animal dungs, because, okay, this is predominantly in the soil. So it's a spore-forming anaerobic bacteria that is found predominantly in the soil as well as animal dungs. So it's transmitted through contaminated wounds, burns, circumcisions, and of course during, what do you call this, umbilical, this traditional umbilical called severing and clamping. You know, traditionally they will apply what? Cow dung on that in some villages and remote area, and of course, you know, that is a reservoir for tetanus. Is predominantly found in animal dungs as well as the soil, and that is what they use to patch up what do you call it, the umbilicus. Now, risk factors include dog bites, snake bites, okay, ear piercing, unvaccinated children. How is it prevented? Now, primordial prevention is all about preventing the occurrence of risk factor. How is that achieved? Governments institution of policies to prevent the spread of the disease by making tetanus toxoid vaccine readily available in healthcare centers. Now, this is very challenging. You should know about cold chain. You will see that in your exams. You will see a box and a cooler. It's a common thing in your exams, in your picture test. It's all about cold chain. How it appear in the exam, you see a cooler. You know these food flags, cooler. Yes, related to vaccine. When you see the question, you know the aim of this object is used for transportation of vaccine. A, to do what? B, is to maintain what? The cold chain of that vaccine. Now, one of the challenges of this tetanus vaccine, they have to be maintained in a cold chain. It has to be transported in ice. Those coolers, you have what? Ice packs in them. But when you go to hospitals, you see this vaccine in fridge and there's no light for more than 48 hours in that hospital. And they'll go for vaccination and they'll use a toxoid that is not potent. So you'll be claiming, okay, this child has been vaccinated. Why that vaccine? Maybe it was in the market, inside carton, where it was imported. And in the market, you have it kept in the store, a very hot store without ACs, air conditioning, and all that. So, in other words, I'm trying to point out that cold chain is part of your exams, and you will see something like that on the picture test. When you see a cooler that looks like food flags, yes, and they are asking you about, yes, this is it. vaccine carrier. So you can browse on that and see how it appears. That vaccine carrier is to maintain cold chain. What do they place inside the carrier? Ice packs. Yes, to maintain that temperature. Okay, the government's or institution policies to prevent the spread of the disease by making tetanus toxoid vaccine readily available in healthcare centers, and the cold chain should be maintained. Now, in your MCQs, I asked some questions on cold chain in your multiple choice questions. So I think you should read about that. You'll come across those things in your exams. So secondary prevention is aimed to detect and treat tetanus in its early stage. Early stages to prevent the complication. Now, yes, there are some certain definitions you need to know about tetanus, the incubation period, the onset time of tetanus. Who can tell me? Yes?
The incubation period is 6 to 10 weeks.
Yes, what is incubation period of tetanus? What is the definition of incubation period?
From the point of getting infected to the manifestation of symptoms.
Yes, the point of infection to manifestation of symptoms is the incubation period, and for tetanus is about 14 days. So what is the onset period of tetanus? What is the difference between incubation period of tetanus and onset period of tetanus? No, what is onset period? Tariq.
Onset period, that would be incubation period is the first symptom.
Yes, the first spasm usually. Yes, that is it. Not from the not from the incubation period. Yes, what is the first symptom?
Christmas.
What is Christmas? Yes. So between that and the first spasm. Okay, let's continue. Please, you have to read about all those definitions: incubation period, onset time, those definition of terms. We'll do that in our OSCE. Okay, now, early diagnosis. Screen for symptoms as lockjaw, that is trismus, Rhizos sardonicus. What is Rhizos sardonicus?
Devil's smile.
Devil's smile. Why do they have devil's smile?
Into the spasm of the
facial muscles. Have you ever seen a patient with devil's smile? They are actually smiling, but not for fun. You see, they have this fishy, okay, Rhizos sardonicus, devil's smile. It looks like it's because of the spasms of the facial muscle. Now, opisthotonus, this is not an early sign actually. It's spasm of the back muscles and they assume a position. They can have seizures, generalized spasms, and so on. And you should know the various forms of tetanus. This is just a little digression. What are the various forms of tetanus? Various forms of tetanus, the various forms they can present. That is called what form of tetanus? Now, tetanus, they can present as neonatal tetanus. Tetanus neonatorum, is that also? It's a form of tetanus. They can present with what? Localized tetanus. They can present with a generalized tetanus. They can present with what? Bulbar, you mentioned. Okay? Those are various forms of tetanus. Okay? Okay. Now, the next is prompt treatment, resuscitation, give tetanus serum, to neutralize. You know, at that point of manifestation, will the toxoid work?
No.
No, you want to neutralize because the toxoid is to aid the patient what? To generate their own immunity. So somebody that is already having spasm, you want to give tetanus toxoid. No, at that point, you give what? A preformed antibody that will neutralize the toxin. You know, of course, these toxins will stick to what? The nerve and they ascend. That's why the closer the injury is to the head, the earlier the manifestation of the symptom. And they prevent breakdown of the acetylcholine at the ganglion. So there's repeated firing. Okay, so the closer to the CNS, the faster the onset of the symptoms of tetanus. So you resuscitate, give tetanus serum, you do wound debridement. Okay? You remove dead tissues because it will encourage proliferation of more of the bacteria. You clean with agents like hydrogen peroxide because the organisms are what? Anaerobic, and hydrogen peroxide will release some oxygen. Then analgesics, give antibiotics, and you also isolate the patient. You know that. Why are they isolated? Yes, there could be triggers. So you isolate them in dark room, not because this disease is transmitted from one person to another. No, it's because you want to minimize trigger. Now, tertiary prevention is aimed to minimize a long-term consequence and disabilities caused by tetanus. Okay, limiting disabilities, minimize complications such as laryngeal spasm, pneumonia, pulmonary embolism, renal insufficiency. So you give IV fluids, IV antibiotics, nurse in a dark room. You have to give pass catheter for bladder care. You have to regularly, okay, take care of their bowel because they pass feces. Okay, you have to clean them up. If not, they will develop what? Bed sores. If they soil up themselves, it will be a cause of bed sores. So good nursing care and monitor urine output. You suction the patient. You have to feed the patient by passing NG tube. Okay, and feeding the patient. Rehabilitation, provide physiotherapy. And of course, you have to nurse patients. You see, once a patient develops bed sore in a hospital, it's an indicator of poor nursing care. Any patient that develops bed sore in a hospital, that translates to a poor nursing care. No good bladder care, bowel care, regular turning. The beddings are not changed when they are soaked. Okay, so you should know all these things. Now, provide psychotherapy, vocational therapy, nutritional therapy, family support, review by specialists in case of organ failure. Now, quaternary prevention. What is quaternary prevention? We did not talk about this. Who knows what quaternary prevention is? Quaternary. Then what of tertiary? Really? Now, quaternary is preventing overtreatment. You want to kill fly with sledgehammer. Of course, the fly will die, but that head where the fly is will also suffer. Do you understand? You overtreat a patient. For example, somebody come with malaria. You give him quinine and you also give him artesunate. You now say, okay, let me give you prophylaxis. You now give him Fansida. You see, you are just over-treating. So that is quaternary prevention now. It's over-treatment. So anytime you are managing a patient, you avoid over-treatment. That is quaternary prevention. Just give a patient what he needs. Don't over-treat, because over-treatment will cause serious negative outcome. So now, Lassa fever, this is a very common exam question. And why is it very significant? A lot of doctors have died from Lassa fever. A lot of doctors died from Lassa fever. So it's very important. And of course, you can see something like this. Now, listen, Lassa fever, yellow fever, cholera. You must master this one. So, Lassa fever, yellow fever, cholera. If you want to know any level of prevention, please know these three. Then, yes, of course, diphtheria that had outbreak, but these are recurring levels of prevention. The ones that keeps recurring again and again: yellow fever, Lassa fever, cholera. They can introduce anyone, but these three must be at your fingertips at any point in time. Lassa fever is an animal-borne, zoonotic. What are zoonotic diseases? Animals? Who can give me a proper definition of zoonotic disease? She said it's a disease that is transmitted from animals to what? Humans. Is that all? So you transmit disease. You said vice versa. You transmit disease to animal. How? Tell us. We are interested. Tariq. No, you won't withdraw that statement. Tell us, how will you transmit infection to?
That's right. So anthropogenic was from man to animal. Animal to man.
Okay. Okay, let's go back to our definition. From animal to man. Is malaria a zoonotic disease? She said, mosquito, insect is an animal. Is it animal? Oh, you mean mosquito is a plant? You have two kingdoms now. It's either animal kingdom or plant kingdom. It's mosquito. You said mosquito is a plant.
To complete the definition, then you have to put something about not being a vector.
No. Vector is just a career now. What is zoonotic disease?
The disease usually affects animals, but then not transmitted to humans.
No. Which type of animals usually? They are vertebrate. Not vertebrate, because you just get confused. You start saying mosquito, you start saying yes. Usually it's a vertebrate animal. So Lassa fever is an animal-borne or zoonotic acute viral illness spread by a common African rat. It's a multi-mammat rat, Mastomys rat. They have a lot of mammary gland. That's why you call it multi-mammat, like 14 pairs. They have so many breasts. Have you ever seen a rat breastfeeding before? No. You'll never see a rat breastfeeding. So these rats have multiple breasts. They are small rats, 14 pairs. That's why they are called multi-mammals. You see them tiny rats, they are common in African regions. Nigeria is an area of epidemic. Then you should know other African countries where epidemic for what do you call it, Lassa fever occur. Nigeria is one of them. We have lost a lot of doctors from Lassa fever. Okay, how is it prevented? Targets the entire population and aim to reduce the risk factor. That is primordial. This can be done by health education. You see, sometimes you go to fetch rice to cook and you see rat feces inside. You see, there is trouble there. Some of you will just pick out that feces and discard. Okay, you say, let's go and wash the rice. Yeah, you see, you are a culprit. He says small disease doesn't kill Africa. And most of the Africans die from Lassa. Have you ever had a white man dying from Lassa? So small disease kills Africa. So how will you prevent that? I know you are using rat shit inside your rice. How do you prevent it? You put medication inside the rice. Then you now cook the rice with which type? Pia or shell tox? You discard the rice in this very hard economy. How do you prevent rice, that rat from entering your rice? Excellent. You don't leave the rice inside the bag and you just tear it. You use scissors and tear a hole and you'll be fetching from that bag. The next time you fetch, you just be eating rat shit. So you get a plastic container, okay? Okay, you pour the rice inside and cover that. You seal it. When you come to fetch, the rat cannot enter. Sometimes the rat can eat up the bag and enter, and it's even sleeping there. So most of the time, this is common. You have to educate people that, of course, they shouldn't leave their bags open like that. Okay? They have to place the food items in container and cover up all those containers, because if they just leave it in the bags, the rat will have access. You see them very tiny rats, and those are the ones that spread the virus. Proper disposal of food items, because if you don't dispose food items, it will attract all those rats to come and eat now. You leave the dustbin in your kitchen for 2 weeks, it's smelling there. Of course, the rat will come and enter the kitchen looking for food. And from there, when they finish the dirty ones, they'll now look for the good ones to spoil. And they'll see your bag of rice open, that is the end. And you can imagine how many people will be infected. So health education on how to preserve food. 2, proper disposal of food. In fact, why should you be even disposing food? You should cook what you need now. You shouldn't be cooking excess and disposing food when some other people are hungry. You should know how many cups will be enough for 5 people. Not that you just go and fetch full pot and dispose everything. And you are attracting pests and some rats to transmit infections. So environmental hygiene. A good environmental sanitation, okay, clear out hideouts for all these rodents. Improve sanitation. So all this even prevent the occurrence of the risk factors. They don't even come to the environment. Primary prevention is specific prophylaxis. 1, by isolation of suspected individuals. I could remember some few years ago where some of our doctors operated on a patient with Lassa. They did CS for that patient. The doctors involved, all of them. In fact, we lost the house officer that assisted the operation, she died. And all those involved developed serious hemorrhagic disease. So they have to be isolated. The peri-op, the surgeon, the assistant died. That is the house officer. So it's a very serious issue. You can see why it's an important, why I kept on emphasizing that you should know about Lassa. And they ask it in exams. So specific, you isolate suspected individual, use of personal protective equipment, and post-exposure prophylaxis with what? Ribavirin for exposed individuals. This is an antiviral agent. Secondary prevention aims to diagnose suspected cases early and treat them to avoid complication. One, how do you do that? Identification of viral antibodies or proteins with ELISA, treatment with ribavirin, antibiotics, analgesics, IV fluids, tertiary prevention, okay? You have dialysis to prevent complications, that also. Diuretics to prevent pulmonary edema, ICU for organ support, proper hydration, and transfusion, psychotherapy, vocational therapy, social support. Now, what is the most effective tool for prevention of disease transmission? Who knows? The most effective tool for prevention of disease transmission. Yes, let's see whether those guys online know. If you know, unmute yourself and answer. What is the most effective tool for disease prevention? Who knows? Yes? S.A. Yusuf, you are unmuted, so answer. Who is S.A. Yusuf? Yes, what is the most effective tool for disease prevention? No. What if you educate someone?
Washing of hands.
Hand washing. Hand washing is the most effective tool for disease prevention. You should know that, please. And never forget. Okay. Let's continue. Where are we? We are done with Lassa fever. COVID-19, okay. COVID-19 stands for coronavirus disease 2019. It's an infectious disease caused by severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2. The mode of transmission is by aerosol, contact with contaminated surfaces. Clinical features include cough, fever, headache, loss of taste, smell. You know, when this COVID came newly, it was a very scary thing because it was new. Everybody was going into hiding. You start hiding from your friends. I shut down my clinic. Somebody called me, Dr. Bashir, where are you? I said, what is the problem? He said, I have fever, I have insomnia, I can't smell anything. I just switch off my phone. You can imagine, so you have all these things and you are looking for me. You know, the disease was not clear. Everybody was so scared. You run away from your friend. Your phone is always switched off. And to compound the whole issue, people started dying. You see 500, they'll say they buried 500 people. So when COVID came, especially during that lockdown 2020, everybody was scary. People were dying. Okay. So And then a lot of us had it too. You'll be having some itchiness in your throat, as you are not even aware that you had COVID then. So, one common symptom that was present during that time was what? Loss of smell, anosmia. Okay. So, what are the preventive measures you take? Primordial prevention. Okay. You maintain social distance, avoid crowded areas, wearing face masks, regular hand washing with soap and running water, not stagnant water, use of hand sanitizer, avoid touching the T-zones of the face. Okay, then you cover your nose and mouth with tissue or bent elbow when coughing or sneezing. Okay, you don't want the risk factor to even occur. There was one clip I was watching during that time. I think the president was giving a speech. Somebody was standing by him. He just sneezed. The president sneezed. So the man standing to him, he tapped the president. He now demonstrated. He said, do like this. Use your elbow to cover your nose. You can see then it was so scary. So all these are primordial prevention. Then primary prevention are specifics using vaccines. There are various types of vaccine, as AstraZeneca, Pfizer, all those ones, yes. So chemoprophylaxis, this is a mistake here. What do you use? Yes, ivermectin. What do we use again? Chloroquine. Was it working then?
Yeah.
When they were using chloroquine became that was for treatment. What do we use to prevent that? Isolation. No, not that isolation, of course. Okay, let's go on. So ivermectin, you use it for chemoprophylaxis. Health workers should use personal protective equipment like face mask, shield, hand gloves, sterilizing medical and personal equipment regularly. You know, this transmission could either be direct or indirect. Is that not so? Direct is via aerosol. You just go and sneeze on somebody's face. Or indirect is sneezing on a surface and someone touch on that surface. And he now rub on his eyes, nose, and mouth, the T-zones, eyes, nose, and mouth. That is indirect. So somebody will shake. You see some people, when they want to sneeze, they will sneeze on their hand. They will cover their face and sneeze on their hand, and they will come and shake you. You see, when you shake people that are unhygienic, you actually eat a lot of dirty things. So. Some people sneeze and cover their nostril with their mouth. In fact, some people will put their hands in their trousers and they are scratching their groin. Then they will come and shake you. You go and eat without washing your hands. So that's why we talked about hand washing as the most effective way of preventing disease transmission. Then secondary prevention is early diagnosis and prompt treatment. One, isolation to confirm case and contact tracing of such patients. Quarantine, you should know the difference of all the definitions for all this. Isolation, quarantine, and what? All those things we mentioned. We'll have a lecture on that, okay, during the workshop. So, then diagnosis of COVID-19 is made by taking nasal or pharyngeal swab sample for real-time polymerase chain reaction, rapid serological tests to detect COVID antibodies, all these adjuncts like chest x-ray, full blood counts, and all that. Treatment is with supportive is supportive with oral or IV fluid, analgesic, antipyretic, antitussive, azithromycin, zinc, vitamin C, ivermectin. Tertiary prevention is to limit damage and prevent complication, as well as rehabilitation. So you continued skill and specialized care, continue IV fluid, oxygen supplementation, mechanical ventilation. This is when it has already gone advanced. You know, when COVID-19 came in, when they were politicizing it, everybody started talking about ventilators when there are no isolation centers. When people don't know how to do hand washing, they are talking about the end stage. So you should be talking about the early stage of prevention. Chickenpox. Chickenpox is an airborne disease caused by varicella zoster virus, which causes an itchy, fluid-filled blister rash-like on the skin. I believe all of you have had chickenpox before. You've never had chickenpox, so you are at risk. You've never been exposed. You've been vaccinated for chickenpox. When was that? I don't agree. So primordial, of course, you educate the general masses through media that chickenpox is an airborne disease caused by varicella zoster. Mode of transmission is through air droplets, sneezing, coughing, saliva, skin contact. And risk factors: patients at risk, pregnant, unvaccinated children, newborn. Now, primary prevention is specific prophylaxis, like giving vaccination, vaccines, promote health or personal hygiene, cover the mouth or use of face masks, good nutrition, and enhance immunity. Secondary prevention, early diagnosis. Most of the time, PCR. Now, you should remember, early diagnosis is early detections of symptoms of this patient before going to laboratory investigations. And commonly, PCR is used for rapid diagnosis. Treatments are supportive by giving antipyretic, analgesics, antiviral, and antihistamine. Okay, tertiary, you have limitation of disabilities. Quaternary, counseling, vocational therapy, nutritional therapy, review of specialty in case of organ damage. Now, typhoid fever. Typhoid is also common. It's so common that anybody that have fever, the common man will say, I have malaria and typhoid. It's so common, everybody will say malaria and typhoid. You see somebody will tell you, I've treated malaria, and they say my typhoid is high. And they will give you a Widal test that is useless. Nobody does Widal test again. Why? What do we use in diagnosis? What is the gold standard for diagnosis of typhoid? Blood culture. So it depends on what, whether you use blood or stool culture or urine. It depends on when. Timing, go. You have to understand the life cycle of this infection, or how it's the transmission rather. Now, typhoid fever is most common in parts of the world where water and food may be unsafe for sanitation, and sanitation is poor. Okay? Now, you should know that getting vaccinated, choosing food and drinks carefully, washing your hands are the best ways to avoid getting typhoid. Typhoid fever usually is commoner during rainy season. Who can tell me why? especially in villages.
Flies.
Yes. You know, during rainy season, all those people that defecate around those streams, the rain will wash all their feces into the stream, and that is still the source of water for their cooking and drinking. Okay? You see, it means anybody that has typhoid has ever eaten somebody's shit. No, that is the meaning now. Transmission is fecal-oral. Is that also? Have you ever had typhoid before, Aliwa? You can't say no. Have you ever had typhoid? That means you have eaten somebody's shit before. In other words, transmission is what? Fecal-oral. Okay. That's why it's commoner during the rainy season. So how do you prevent it? Primordial health education. Promotion of health in the positive sense through nutrition, personal hygiene, suitable working environment, and healthy living habits has a definite relationship to prevent typhoid. Poverty alleviation. Most of these diseases are related to poverty because poverty itself is a disease. Primary prevention, vaccination. Typhoid vaccine are only 50 to 80% effective, so you should still be careful about what you eat or drink to lower your risk of getting typhoid fever. A pill vaccine, shot vaccine, then you have hygiene and sanitation, proper hand washing, okay? Wash hands often with soap and water for 20 seconds, especially after using bathroom or before eating. Most of you here, I've seen some of you just start eating without washing your hands. Maybe you have shaken somebody with typhoid. That person might be a carrier. You know carrier, right? They have a lot of these organisms in their gallbladder. They are carriers. They will just be spreading the infection. Okay, so always wash your hand, not because of your own hygiene, if you trust your own hygiene, but because it can be transmitted from someone else to you. Keep your hands away from your face and mouth. Incidence of typhoid can be dramatically reduced by provision of safe water, that is potable water, protection of water source from contamination, and promotion for use of latrine. You remember when we talked about source contamination? When we talked about contamination during your MCQs, we've discussed some MCQs on contamination.
Epidemiology,
yes.
Source, common source, propagated, mixed.
Okay. We are still going to revise all those MCQs. You see, you have forgotten so quickly. The incidence of typhoid can be dramatically reduced by provision of safe water and all that. We mentioned that, then healthcare access. So in summary, primordial prevention is by education and poverty alleviation. Okay, so you don't want the risk factors to occur. Then specific is providing vaccines and what do you call it? Personal hygiene and sanitation. Then secondary is early detection of symptoms and what? And treatment. So early diagnosis, what are the early symptoms of typhoid fever? Early symptoms. they could have abdominal pain, constipation, before diarrhea, then fever. Okay? Headaches. You see why it's similar to malaria. Adequate nutrition. No, this one, not really. Steroid administration, not really. Nobody does this now. It's antibiotics. Then cholecystectomy if necessary to prevent chronic carriers, because this is stored in their gallbladder, the organisms. Tertiary prevention, reduce the progress or complications of established typhoid in the aspect of therapeutic and rehabilitative medicine. So you have to treat completely to prevent intestinal obstruction, intestinal perforation like typhoid ileal perforation with generalized peritonitis. Whooping cough. What is the other name for whooping cough? Pertussis. Or Chinese call it 100 days cough. So how is it prevented? How many do we have now? So that it's going to be an interactive session. It's the same thing now, so that it will be faster. There are so many. Okay. So you can unmute yourself. I'll be calling you one after the other. You are tired? Or should I start with let me start from the right. Yes, you can unmute yourself. Let's have a little interactive class. Yes. Whooping cough. Let me look for somebody to tell us. We have so many Fatima here. Fatima McIntyre. Where are you? Unmute yourself. Where is she?
Yes, sir.
Tell us about prevention of whooping cough.
Okay. I should say the level of prevention, like everything or what? Sorry.
Of course, you won't be asking the examiner when he asks you question because you have only 5 minutes. Tell us the level of preventions for whooping cough. That is pertussis. In case.
Okay. We have for levels of prevention, we have the primordial. We have that is general health primordial, that is the government policy and laws. Then we have the general health promotion. That's where we educate the mass using media seminars. That's pertussis is an airborne disease, and it is caused by it is caused by a bacteria called Bacteria pertussis. Then the mode of transmission is through airborne by sneezing or coughing. Then the risk factors are unvaccinated children. We have overcrowding and poor ventilation areas, and epidemic exposure. Then we have this specific prophylaxis. We have the pertussis vaccine, that is the pentavalent diphtheria, pertussis, and tetanus vaccine. Then to avoid the risk factors like overcrowding and poor ventilation, isolation of suspected cases, wearing of masks around suspected children, and then we give, I think there is erythromycin for contacts. Then we have the early diagnosis and prompt treatment. Here we screen for symptoms like runny nose, severe paroxysmal cough fits, and pertussive emesis. Then investigations that are done, it is usually clinical. Then there is nasopharyngeal culture, there is full blood counts, there's polymerase chain reaction, and there's direct fluorescent antibody. Then for the treatment, we have we'll give antibiotics, clarithromycin. Then to limit disabilities, we limit complications like dehydration, seizures, and convulsions by doing aggressive management, by giving IV fluid, rehydration, continual antibiotic, and anticonvulsants. Then for there is rehabilitation by counseling, vocational therapy, family guidance support, review by specialists in case of any organ damage.
Why are they usually dehydrated?
Because of the vomits here, I think.
Yes, because of the pertussive vomit.
Pertussive vomit, yeah.
They vomit continuously. Okay,
Yes.
and it ends with what? A vomiting. Okay. So which categories are at risk when you are educating in the primordial?
In the primordial?
Which individuals are more at risk of developing pertussis?
I don't know. I'm not sure.
Of course, it's children. Of what
Children.
age? Yes.
I think under 5 years, yeah?
Yes, under 5. Yes, you tried actually. She did well. I think Fatima is ready for exams. Okay, well done. Okay, primordial goods, governance, reduce exposure to disease, of course, education. Government enact laws, policies to limit migration.
Wallahi, kawai ina busy ne su days kuma na san kawai ina
Who is this
wannan ɗin ki kawai da ake distracting ina shi za.
Mukhtar Garko.
Allah ya ba shi hakuri ne ba.
Mukhtar Garko. Okay. He's not paying attention. He's just making noise. Mukhtar Garko. Okay. You've muted him. Okay, let's continue. Yes. Then, now specific prophylaxis here. You remember the vaccines, the DPT vaccine. There is a pertussis there. That P is pertussis. Then secondary early detection of symptoms and treatment. Then you diagnose. Most of the rapid diagnosis for most of this can be done by PCR. Most of this infection, if you forget, PCR, most of them. The antibiotics that is given for treatment is actually to limit the spread. It's just to limit the spread. Okay. So those are, she really tried on that one. So polio, let me get someone else. Where is Muhammad Yusuf? Yes, I've not been seeing him. Muhammad Yusuf. Is he in the class? Muhammad Yusuf. Muhammad Yusuf, where is he? He has disappeared. Yes, you are here. Tell us about polio. Levels of prevention for poliomyelitis. It's not paying attention. Muhammad Yusuf, are you there? He's not with us.
Hello?
So after you stop that echo, you still answer the question. Yes. Polio. Okay, he's not there. We've lost him. Where is MM? Is she around?
Yes.
Okay, tell us levels of prevention for polio. MM,
Hello, sir.
tell us levels of prevention for polio.
Okay. Levels of prevention for polio. Levels of prevention. We have primary, secondary,
Why are you skipping primordial?
primordial, primary, secondary, tertiary, and quaternary.
So what are the
So-
components on all this? Each.
Okay.
Primordial, what will you do?
For primordial, educate the general public.
Okay,
Tell
educate
them
me.
that-
Tell me, what will you tell them?
I will tell them the definition of polio.
No, define it for me. Tell me, I'm the population now.
Okay, so
What causes
polio,
Is it a
polio-
bacteria or a virus?
virus.
Okay, tell us about it.
Okay, sir. I can't remember the name.
I continue. Polio virus. How is it transmitted? You want to see,
Through contaminated food or water.
when you are educating the population, what you tell them actually, the agent, how is it transmitted, and how do symptoms manifest, and how they can be prevented. That is what you basically tell the mass media, via mass media. Tell the population. Okay?
Okay, sir.
Poliomyelitis is highly infectious disease caused by a wild polio virus that can be of any 3 serotype. It invades nervous system and cause paralysis or even death in a matter of hours. Okay, so provision, the primordial, you want to eliminate or prevent occurrence of the risk factors by provision of clean water, improve hygienic practice and sanitation to it, okay, for reducing risk of transmission in endemic countries. Primary, okay, you also educate the public and give vaccines. Vaccinations are specific prophylaxis. Okay, polio vaccine. This is very common now. Vaccination is one of the effective means to achieve prevention of poliomyelitis. The vaccine used for immunization are 2 types: inactivated polio vaccine, IPV, or oral polio vaccine. Which one do you know? MM,
Sir,
which one have you received?
I received the 2.
Which
Yes,
one
sir.
is common now?
The oral is more common.
Yes. So secondary prevention is early detection or diagnosis and prompt treatment. There is no cure for polio, but there are ways to control the progression of the disease. Okay, it depends on the phase. It has acute phase and the convalescent phase. In the acute phase, you give analgesics, okay, symptomatic. As the disease runs its course, bed rest, splintage of paralyzed limb, active movement are avoided, ventilatory support if there is respiratory paralysis, convalescent phase, you have joints are splintered to reduce pain, joints mobilization exercises begun. tertiary prevention aimed at disability limitation and rehabilitation. Paralysis due to poliomyelitis has occurred, but we try to prevent further injury due to paralyzed legs, limit the resultant deformities that develops. Healthy muscles can be trained to take over some of the function of the nearby muscles that are weakened by the polio. Okay, tuberculosis is also a common condition that can be asked, and the primordial health education, general health promotion is there, and there should be adequate, you tell them about adequate ventilation, avoid overcrowding, high hygiene, cough etiquette, and good nutrition must be practiced. Primary prevention is for specific prophylaxis. You remember the BCG vaccine, isolation of suspected cases, informing appropriate authorities. Secondary is early detection of symptoms, early diagnosis and treatment. You remember the various ways of screening. You use Mantle tests where pure protein derivatives are injected into the subcutaneous tissue, and of course, they will trigger a form of reaction, and you measure that. So you do Zilnensin stain for sputum, chest x-ray, you check for hilar lymphadenopathy. Okay, gene expert. Treatment is using anti-TB drugs. Tertiary, these involve limitation of disabilities and rehabilitation. Check for extrapulmonary involvement like brain, bone scan, liver function test, full blood count, EUCR, surgery for Pott's disease, antibiotic for tuberculosis meningitis. And one good thing about tuberculosis, that is one good thing about the treatment, is they respond to drugs. Any part that is involved, you can use drug in the treatment. Counseling about future exposure and how to take care. Okay, physiotherapy, occupational therapy, social support for recovered patients. Okay, letter from the medical facility to prevent workplace. I remember during my NYSC in the camp where I was, we were in one big hall. You know, it is the ladies that enjoy service. All the guys, it's primary, you don't have rooms. They'll just put you in classes. These primary school classes, when you are going in, you just pick mattress at the gate and one pillow. You drop everything you come with. So we are in this big hall in the class. Somebody just started coughing blood. I don't know whether he actually planned for that. We just quickly took him to the camp commander. He just immediately relocated him. Automatic relocation. So you have to give proper report on somebody that has that infection so that he doesn't go and spread it in gatherings. So he can be excused from duty. Now, cholera is a very common one in your exams. Of course, health education and promotion, tell people how that is caused by cholera. Fibrocholerae, a bacteria. Okay, the transmission is fecal-oral. Yes, you have to, and the patient will present with profuse diarrhea, rice water, stool, and all that. You educate the mass in the primordial. Okay. Health promotion through hand washing with soap after defecation, before eating food. Okay. Personal hygiene, cholera vaccine. you educate them. So the specific prophylaxis, that is the primary prevention, is use of vaccine. Then proper sewage disposal so that flies don't perch, take up those fibrocholerae and transmit them to your food. Proper hand washing, environmental sanitation, early detection of symptoms. They present with fever, diarrhea, rice water stool, they become dehydrated. So you treat with ORS, 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 very, very important. How is it diagnosed in the lab, laboratory investigation? Rapid test with PCR can give you that, okay? So the investigation there, you can use PCR. So the early diagnosis is the symptom, the early symptoms, then the investigations are those tests you do in the lab, okay? Then tertiary, nutritional support, vocational therapy, treatments of complication, family support, because most of these are people that develop cholera, low socioeconomic class. So you have to give them family support. Diphtheria is an infectious bacterial infection caused by Corynebacterium diphtheria. It's transmitted by airborne droplets, direct contact with discharge from the nose or mouth, or indirect contact with fomites. Okay, so you know, of course, the primordial is by education, avoid overcrowding, use of post-exposure prophylaxis. Now, what are the specific prophylaxis for cholera, please? Specific prophylaxis for cholera. Cholera vaccine, we mentioned that. Then those that are exposed to individual, how do you prevent that? You give what antibiotic? Doxycycline. A dose of doxycycline, yes. We forgot to mention that. It's not on this slide, don't forget. In your OSCE, you see it on the marking scheme. You see it on the marking scheme. You give specific prophylaxis, cholera vaccine, as well as doxycycline, a start dose for an individual that is exposed. So let's come back to this diphtheria. The specific prophylaxis is vaccination. Okay, the pentavalent vaccine at 6th, 10th, and 14th weeks of life. Use tabs erythromycin for exposed individuals. Then early detection of symptoms. What are the early symptoms of diphtheria? Sore throat. What again? Fever. So how do you diagnose it? Clinical. If you want to do laboratory, is how? PCR. What again? To look for what? You just take culture, you don't know what you are looking for. And after the culture takes how many days? 5 days. The patient has died. So those rapid tests are better, especially in epidemics. Do you understand? Rapid tests are better than culture in any form of infection in epidemics, because rapid tests will give you a straight diagnosis, a rapid intervention. You can't be waiting for culture for 5 days when hundreds are dying. So treatment is with benzyl penicillin, IV diphtheria antitoxin to neutralize the toxin, analgesics, adequate hydration, can give vitamin C. Now limiting disabilities and managing complications in tertiary prevention like acute kidney injury, acute tubular necrosis. You do what? Dialysis. Is that also? Airway obstruction, you intubate patients and ventilate. Bleeding control. Myocarditis, you give antibiotics and analgesics. Then quaternary prevention. Here it is aimed at restore function, but we say quaternary is prevention of overtreatment. We give psychotherapy, vocational therapy, social and family support. Malaria, as common as this, you can be asked malaria. Okay? What are the specific prophylaxis for malaria? No, I said, what are the specific prophylaxis for malaria? No, I'm asking him now. Look, man. So environmental sanitation, use of insecticide-treated nets, use of insect repellents, malaria vaccine has been developed. Is that also? Yes. So malaria vaccine have been developed. It's a specific prophylaxis. Then chemoprophylaxis for malaria. So various individuals like pregnant women, sickle cell disease patients, those that are exposed to malaria endemic areas, especially coming from areas where there is no malaria. So those are the categories you give prophylaxis. Those are high-risk individuals. Then early detection, symptoms, fever, headache. The investigation you do, you can do rapid tests, you can do what? Peripheral blood film, and what again? Okay, the treatment is using artemisinin-based combination therapy, ACT. Tertiary prevention. Complications like cerebral malaria. How do you prevent that? Early treatment of simple malaria. Yes. What other complication? Anemia. Measles. So, I think it's already 10 o'clock. So you have these slides. I'll share it on the group. You are going to read measles, meningitis, HIV, hepatitis, yellow fever. They will ask you yellow fever in your exam, so you better go and read it. Yellow fever, what are the common ones? Diphtheria, what again? Cholera, Lassa fever. Please, you should know this very well. They might ask you any of them. Then one of these worms like filariasis, yellow fever, cholera, Lassa fever, diphtheria. Please know this four very well. Yellow fever, Lassa fever, diphtheria, cholera. Okay. Now, you might see an image where you see a worm. They can just show you guinea worm or something and ask you level of prevention. So you also read about these worms, how to prevent them. Okay, look at filariasis. You also read about it. So we are going to stop here, please. Any question? So you have the slide on the group, please. Then you add more to the slide. You can print it out and be doing your jottings by the side. There are some things that might not be there on this slide, so you add and read. Just master the common, these are common things that are asked in the exams. So we are going to stop here. Thank you everyone for participating.
Thank you, sir.
You're welcome.